Now let me discuss the actions of the sympathetic nervous system on the various organs. So first let me tell you the actions on the heart. Right, the actions of the sympathetic nervous system on the heart. The actions of the sympathetic nervous system on the heart is by stimulating the beta 1 receptors. Right, by stimulating the beta 1 receptors. So by stimulating the beta 1 receptors, remember the sympathetic nervous system, it has positive chronotropic action. Right, now what is your chronotropicity is, it will increase the heart rate. Right, the sympathetic nervous system will increase the heart rate. Next, by stimulating the beta 1 receptors, it will also have the inotropic action, that is positive inotropic action, that is will increase the contractility of the heart. Right, will increase the contractility of the heart. Next is positive dromotropic action. Right, positive dromotropic action. What is dromotropicity is? It increases the velocity of conduction of the impulse. Okay, so the sympathetic nervous system on the heart, it has positive chronotropic, positive inotropic, and as well as positive dromotropic effect. Right, and all these particular effects are due to stimulation of the beta 1 receptors. Next, let me tell you the effect of the sympathetic nervous system on the blood vessels. Right, the effect of the sympathetic nervous system on the blood vessels. Now within the blood vessels, like we have two important the sympathetic receptors. Right, so we have alpha 1 receptors are there within the blood vessels. Beta 2 receptors are also present within the blood vessels. A point that you should remember is, if alpha 1 receptors are stimulated, that will cause vasoconstriction. Okay, if alpha 1 receptors are stimulated, that will cause vasoconstriction. Whereas you take the beta 2 receptors. If the beta 2 receptors are stimulated, that will lead to dilatation of the blood vessels. Right, that will lead to vasodilatation, that is dilatation of the blood vessels. Now, the effect of the sympathetic nervous system, remember this point, the effect of the sympathetic nervous system on the blood vessels, it depends upon the predominant type of receptors. Right, the effect of the sympathetic nervous system on the blood vessels completely depends upon predominant type of receptors. Right, whether it is alpha 1 receptors predominantly present in that vascular bed, or is it beta 2 receptors which are present within the vascular blood. So based on that, the action of the sympathetic nervous system will be there on the blood vessels. Now for example, you take on the blood vessels of skin, right, and you take the blood vessels of the mucosa, and you take the blood vessels on the splanchnic system. Okay, that is splanchnic blood vessels. So on this particular blood vessels, the predominant type of sympathetic receptors are alpha 1 receptors, So because the predominant receptors are the alpha 1 receptors, here the blood vessels, they will undergo vasoconstriction. Right, here the blood vessels, they undergo constriction. Whereas you take in case of the skeletal muscle. In case of skeletal muscle blood vessels, okay, so in case of skeletal muscle blood vessels and as well as the coronary blood vessels. Right, as well as the coronary blood vessels. In both of them, the predominant type of receptors are the beta 2 receptors. Right, the predominant type of the receptors are the beta 2 receptors are present in excess quantity. Now here in the blood vessels of the skeletal muscles, in the blood vessels of the coronary, when the sympathetic nervous system acts, there will be vasodilatation. Right, there will be vasodilatation. All right, next you take on the renal vessels, that is over the renal artery or the renal vein. So if you take on the renal vessels, they contain both alpha 1 receptors are there and they have dopamine receptors, that is D1 receptors. So this renal vessels, they have alpha 1 receptors and D1 receptors, that is dopamine receptors. If alpha 1 receptors are stimulated, there will be vasoconstriction. If D1 receptors are stimulated, there will be vasodilatation. Right, there will be vasodilatation. Okay, now a point that you should remember here is, whenever the sympathetic nervous system is stimulated, what it will do to the renal vessels. Remember, because the renal vessels contain both alpha 1 and D1 receptors, when the sympathetic stimulation occurs, this sympathetic stimulation cause less increase in the vascular resistance here than in any other vascular bed. Right, so what you have to remember here is, when the sympathetic nervous system is stimulated, there is increase in the vascular resistance but less increase in the vascular resistance. Okay, less increase in vascular resistance. Now why do you think that there is less increase in the vascular resistance? Because if sympathetic nervous system is acting on alpha 1, it is causing vasoconstriction. When it is acting on D1, it is causing vasodilatation. So that is the reason why there is less increase in the vascular resistance in the renal vessels than in any other vascular beds. Alright, so let me shortly revise the actions on the heart. First, by sympathetic nervous system, by stimulating the beta 1 receptors, it has positive chronotropic, inotropic and as well as positive dromotropic effect on the heart. By acting on the blood vessels, if you take on the blood vessels, like you have two sympathetic receptors in the blood vessels, alpha 1 and as well as the beta 2 receptors. When alpha 1 receptors are stimulated, there will be vasoconstriction. When beta 2 receptors are stimulated, there will be dilatation. So the effect of the sympathetic nervous system on the blood vessels completely depends upon what is the predominant type of the receptors which are present there. Now for example, you take the blood vessels within the skin, mucosa and splanchnic system, the receptors which are predominantly present are alpha 1 receptors. When these receptors are stimulated, there will be vasoconstriction. Next is in the blood vessels in the skeletal muscles and as well as in the coronaries. So blood vessels in the skeletal muscles and the coronaries, they have predominantly the beta 2 receptors. If beta 2 receptors are stimulated, there will be vasodilatation. Next, coming to the renal vessels. In the renal vessels, they contain both alpha 1 and as well as D1 receptors. If alpha 1 receptors are stimulated, there will be vasoconstriction, and if D1 receptors are stimulated, there will be vasodilatation. So a point that you should remember is, whenever the sympathetic nervous system is stimulated, it will cause less increase in the vascular resistance here than in any other vascular beds. Right? Now let me tell you the actions of the sympathetic nervous system on the GIT, gastrointestinal tract. Now let me discuss the actions on the GIT, that is gastrointestinal tract. Now if you see the actions on the gastrointestinal tract, a point that you have to remember here is, within the GIT, like we have the smooth muscle. Right, within the GIT, like we have the smooth muscle. Now the smooth muscles of the GAT are relaxed. Right, the smooth muscles of the GAT, they are relaxed. How are they relaxed? They are relaxed by stimulation of two important sympathetic receptors. Right, they are relaxed by stimulation of beta 2 receptors and stimulation of alpha 2 receptors. Now remember, this particular GAT is relaxed by stimulation of the beta 2 receptors. This is the direct action, that is the sympathetic nervous system, right, directly it acts on the beta 2 receptors, right, direct action. Whereas you take on the alpha 2 receptors, right, whereas you take on the alpha 2 receptors. The sympathetic nervous system will cause the relaxation of the smooth muscles of the GAT by stimulating the alpha 2 receptors. It is an indirect action. Right, this is an indirect action. Now let me tell you how is this particular indirect action. Now this alpha 2 receptors, what did I tell you? They are present presynaptically, right? When we have seen the distribution, we have seen that the distribution of the alpha 2 receptors, they are present presynaptically, they are also present postsynaptically. This alpha 2 receptors, right, these alpha 2 receptors, they are present presynaptically even within the cholinergic neurons. Not only in the sympathetic neurons, presynaptically alpha 2 receptors are present. These alpha 2 receptors are present presynaptically even in the cholinergic neurons, right? Even the cholinergic neurons, the alpha 2 receptors are present presynaptically. Is that clear? And the presence of alpha 2 receptors in the cholinergic nervous system presynaptically, they are called as the heteroreceptors. Right, they are called as the heteroreceptors. Now a point that you should remember here is, now once these alpha 2 receptors which are present in the presynaptic nerve terminal of the cholinergic neurons, once they are stimulated, that will result in, right, that will result in decrease in acetylcholine release. Right, that will result in decrease in the release of acetylcholine. Right, so once the acetylcholine release is decreased, what will happen? The smooth muscle contraction will be inhibited. It is the acetylcholine which will cause the smooth muscle contraction of the GAT. Now when the acetylcholine release is decreased, what will happen? The smooth muscle will not get contracted, it will get relaxed. So that is about the action on the GAT. Next, let me discuss the action of the sympathetic nervous system on the urinary system. Right, on the urinary system. Now if you take on the urinary system, remember the sympathetic nervous system will cause urinary retention. Now let me tell you how there will be urinary retention. The urinary retention can occur due to two reasons. First, now you take this muscle within the bladder, that is detrusor muscle, right? That is the detrusor muscle. Okay, so you take within the detrusor muscle, of the urinary bladder, you have the beta 2 receptors. Right, you have the beta 2 receptors, whereas in the trigone, right, this is the trigone of the bladder, right, this is the trigone of the bladder. So in the trigone of the bladder, the receptors what you have is the alpha 1 receptors, right? In the trigone of the bladder, that is within the sphincter, you have alpha 1 receptors. Now what the sympathetic nervous system will do? Sympathetic nervous system, it will cause the relaxation of detrusor muscle by stimulating the beta 2 receptors. Okay, so the beta 2 receptors, they are present within the detrusor muscle. By stimulating the beta 2 receptors which are present within the detrusor muscle, there will be relaxation of the detrusor. Next, what it will do by acting on the alpha 1 receptors? By stimulating, right, by stimulating the alpha 1 receptors, there will be contraction of the trigone. Okay, so sympathetic nervous system, by stimulating the alpha 1 receptors, there will be contraction of, right, contraction of trigone of the bladder. Alright, so now you see what is happening by the sympathetic nervous system. Sympathetic nervous system, it is causing relaxation of the bladder, and sympathetic nervous system, it is causing the contraction of the trigone. So thereby what will happen? The urine does not go out. There will be a urinary retention. Right? There will be urinary retention. That is on the urinary system. Next, let me take up on the genital system. Right? Let me take up on the genital system. Now, in the genital system, like for example, you take in case of a pregnant uterus. On a pregnant uterus, like what we have is the beta 2 receptors. Beta 2 receptor stimulation on the pregnant uterus, the sympathetic nervous system will cause the relaxation of the pregnant uterus. Okay, so sympathetic nervous system, by stimulating the beta 2 receptors on the pregnant uterus, there will be relaxation. Right, there will be relaxation. Okay, next. Now you take this beta 2 receptors. Okay, that is about the beta 2 receptor story. Then you have the stimulation of the alpha 1 receptors as well. Now where are these alpha 1 receptors? These alpha 1 receptors, they are present within the vas deferens. Right, alpha 1 receptors, they are present within the vas deferens. They are also present within the seminal vesicles. Right, they are also present within the seminal vesicles. And these alpha 1 receptors, they are also present within the prostate. Right, they are also present within the prostate. Now, by stimulating the alpha 1 receptors of vas deferens or on the seminal vesicles or on the prostate, once these alpha 1 receptors are stimulated, that will facilitate the ejaculation. Right, so once these alpha 1 receptors are stimulated, there will be ejaculation. Okay, so that is the effect of the sympathetic nervous system on the genital system. So a point that, let me revise the actions on the various systems. On the GAT, the sympathetic nervous system, it will cause the relaxation of the GAT. By stimulating the beta 1 receptors, it's a direct action. By stimulating the alpha 2 receptors, it's an indirect action. The alpha 2 receptors which are present in the presynaptic nerve terminal of the cholinergic nervous system, once they are stimulated, they will decrease the acetylcholine release and thereby the GAT is relaxed. And you take on the urinary system, the sympathetic nervous system will cause the urinary retention. The sympathetic nervous system, it acts on the beta 2 receptors which are present within the detrusor muscle. They will cause the relaxation of the detrusor. The sympathetic nervous system will act on or will stimulate the alpha 1 receptors which are present within the trigone of the bladder, and thereby there will be contraction of the trigone and thereby there will be urinary retention. On the genital system, if you see, the sympathetic nervous system, it acts on the pregnant uterus and it will cause the relaxation of the pregnant uterus by stimulating the beta 2 receptors. Next, you take on the alpha 1 receptors. the activation of the alpha-1 receptors in vas deferens, seminal vesicles and prostate that will facilitate the ejaculation.